Good morning. We'll give a couple more minutes, just 1 minute, so everybody can get on. All right. So good morning. Thank you for taking the time on this DSNP webinar. If you guys could raise your hand just to let me know you can hear me and see me clearly. Great. Okay. So my name is Yvonne Blanco, and I'm a broker sales manager here at IAD. I handle all the Medicare products as well as the specialists for the special needs products nationwide. Maybe some of you have already attended DSNP webinars and you know the basics, but I hope to be able to break it down, make it simple, see what from the agent's point of view we should learn and know. So this should take about 30 minutes, I hope. We'll touch on special needs plans, what Medicaid and what is the income limits, what are the steps to verify Medicaid before continuing your presentation and sale. You know, what are those steps? I want to briefly go over commissions and how they look next to renewals and what that income potential is. If you have any questions, please click on the Q&A button, and after the slides, hopefully I can go ahead and answer those the best I can. If you want to talk afterwards, just message me. My intention is obviously to give you an overview of DSNP, hopefully to start a dialogue with each other and see what working with me and here at IAD can bring to your business. We'll have 3 handouts for all the attendees afterwards. So with that, let me go ahead and share my screen and we'll get started. All right. So what are special needs plans, right? Let me get me out of here. Here we go. All right. What are special needs plans? As you have heard, there's 3 major special needs plans. The DSNP, which is your dual eligible needs plan, which obviously you have to have both your Medicare A and B and your Medicaid card, your I-SNP, and your C-SNP. Your I-SNP is obviously your institutional individual, and your C-SNP is for chronic needs. There usually are a list of these chronic needs or the chronic symptoms and conditions and that are severe for each individual that puts them on that DSNP. So most states have dual products, but some of them don't, and they're called a lookalike. So if you see a product that's called a lookalike, more than likely it might have the similar benefits of a dual SNP, but it's not an actual dual special needs plan. Now, most people who are on Medicaid have 2 cards. You have your red, white, and blue, which is your Medicare card that most of you already know, and then your Medicaid card. In Michigan, it's a green card that says Michigan Health or MI Health card on it. Each state, like I said, will have their own card. Keep in mind that in order to have a DSNP, you have to have both of these cards to be eligible for that dual product. I also wanted to point out the number of people that are reported right now on Medicaid throughout our country. Some things to keep in mind, not as a deterrent, but to be aware to create strategies. So carriers will say that these types of people are the hardest to keep on your books, maybe because they're more transient than someone who owns a home. They may switch doctors and plans more frequently because they're looking for most benefits. What's going to be to give them the most benefits or allowances at that moment? But not all of these SNPs are those types. You know, it could be people that were blue collar workers that didn't invest. They were the only breadwinner for their family. They lived paycheck to paycheck and now live on Social Security. You know, those are like my parents. They may have their own home. They own their own car, and they will fall under that poverty, federal poverty level, living solely on their Social Security. So you just have to kind of ask questions, find out if they love their doctor and situations, and we'll go over those in the next slides. So make sure you address the MMP, and we're going to go ahead and go on that. There's some slides in regards to the MMP and auto enrollment. with them at that point. So with that, let's go ahead and go on to see some percentages. So Medicaid is completely separate and does not take away from, or is, from their I'm sorry, the Medicaid is completely separate and doesn't take away or is discounted when they go on a dual SNP plan. To be on Medicaid, you don't have to be on Medicare. So those are two different, a lot of people are like, don't touch my Medicaid when you put them on a Medicare or a D-SNP plan. So just keep in mind that, there's a lot of individuals that are going to be enrolling on Medicaid right now due to loss of jobs. And then the loss of jobs creates stress, and then it creates health issues. For a lot of the states, Medicaid is called different names, but they're all pretty much state administered. So the Medicaid eligibility categories, you've all probably have heard, you have to be full Medicaid or FBDE. So I went ahead and listed all of the categories that you'll hear. Some of the carriers will only accept certain categories. So when you contract with us, obviously I can go over which carrier is accepting which of these limits or levels. So I created just a nice brief, one-page job aid to give us limits on, what those amounts are to be qualified. They're not set in stone. Obviously, if people have assets, they will fall into that. But I think that, I always say it's better to have it and not need it than need it and not have it. So it's kind of information that a broker can have if you come across somebody that maybe they don't even know that they qualify for Medicaid. And that, you now have an idea of what those limits are. I didn't put all of them on there. Obviously, we have, a longer version of this, but just to kind of give you an idea. And this will be one of the job aids that we'll give you for attending. So on this graph, it basically shows the Medicaid categories and what they cover. If you can note, though, that all of them, except for the QDWI, they cover the Medicare Part B premium. So if your member doesn't have that taken care of from their Medicaid, calling their social worker should be probably one of their highest priorities. I have assisted brokers and members with those calls and have had more people tear up and cry after patching this hole in their coverage, that literally you'll have a client for life. I mean, if you think about it, it's not every day you can help a retired senior citizen to get a raise of $144 and some change, right, a month, because you're helping them kind of cover that gap that maybe Medicaid didn't, in their paperwork or whatever was going on, they didn't see to cover that Part B premium. This will also be one of the handouts for you as well. So that was the Medicaid brief kind of overview information. And so now let's get into the D-SNP side of this. Most carriers require the member to have a Medicare A and B in order to be on that dual special needs plan. Each carrier is specific on what Medicaid levels they accept on their plans. Once I assist an agent to be contracted with us, we go over those levels just to make sure you know what is accepted by each carrier. And of course, if an agent forgets, they can always text me or call me. I'm always readily available. And of course, members do have to live in the dual plan coverage area. Some duals are in some counties, some duals are not, as far as the plans. Persons under 65 with both A and B Medicaid are eligible. And of course, eligibility levels and the ability to qualify may be based on the carrier's current plan filing. Of course, like I said, some carriers only offer their plan to an FBDE or a QMB plus, right? So while other carriers will accept all levels. A dual plan, as you know, will be rich in benefits over an MAPD plan. DSNPs offer coverage in dental, vision, hearing, along with hearing aids, transportation, and they'll even give them a quarterly cash allowance for over-the-counter items. So some of the carriers have a really nice catalog for these over-the-counter items. A lot of people get tripped up when they sign up for a plan on how to order. So that is a really good avenue to make sure you keep your member interested, that you keep your member knowing who you are and you build that relationship. There's a lot of assistance for this community of people. And either they don't know about it most of the time, or they don't know where to go get it. They just call a 1-800 number that they see on the TV maybe. But hopefully when you go and you visit anyone that's a dual SNP, or even your present book of business and they're not, passing out, multiple of your business cards, flyers, brochures, maybe a little postcard, whatever it is that you have and that you pass along to them, more than likely that DSNP individual that's on that plan will go ahead and refer you. Referrals are big in this market. So make sure you have your material items to pass out when you're there. And if you don't, we provide that here at IAD. I help members with create and build something that's directly from the agent, so you guys can have those tools. It's really, really important to leave that information so they can have easy access to get back to you or to call you, especially when they get those letters from the state trying to auto enroll them. That is really going to determine about keeping your book. So determining client eligibility. It can be a little tricky, but remember, we got to ask questions and then make some calls. The carriers will have a dedicated hotline for verification. And if you don't have that number, we have those numbers available here. You can also call the state Medicaid's hotline. Each of your state has a Medicaid number that you can call to verify. The information that you'll need to have to find out what level they are on will be like their name, date of birth, Medicare, if they have their Medicare and Medicaid, their numbers you'll need. Usually they will let you know when you're on that call what level they're on. And if they're on that MMP, you can call the number with the member. So just keep that in mind. You can be on that call with them. So the MMP stands for Medicare Medicaid Program, and it is available and we have 9 states participating in this program nationwide. So I listed those states for you, obviously California, Illinois, Massachusetts, Michigan, Minnesota, Ohio, Rhode Island, South Carolina, and Texas. So right now, these members that are on Medicaid will be auto-enrolled by the state for their whatever the participating carriers are for each of those states. MMPs have more at-home services. So keep that in mind. If you run into someone that is on an MMP, you want to ask, do they have home services like a private duty nursing, home health care? They have somebody coming in making meals, helping them, shower, stuff of that nature. Some of them even give assistance with technology for them. That could be maybe paying for their internet or helping them with their bills or their phones, their computer. So where the DSNP plans, DSNP plans that you will be signing them on, they don't have those home services like these MMPs do. So if a member really is using those types of benefits, you would be doing them a huge disservice and hurting their life in a way, by taking them off of that plan. So that's probably the one of the important points you want to make sure that you're not taking that away from them. If they're not getting the services, obviously, and they are on an MMP, then you can go ahead and help them to be more empowered, where you're educating them and they are choosing that plan So you will call the MMP number, whether it's from the state or, um, you know, and we have those numbers actually, or Medicare. You can call them as well. And when you call them, you want to request to disenroll from the MMP. But then you also have to request from being auto-enrolled for any future enrollments. So when you call in, they're disenrolling at that moment from being enrolled if they're in that plan. And then you're also having to request to not be auto-enrolled for any future enrollments, because those do come either quarterly or after 6 months. They'll get a letter trying to go ahead and, auto-enroll them again. So keep in mind, agents and consumers can call together. And for specifics on what health carriers are available in what states, in which counties, you can contact me. I'll let you know which carriers those are. And like I said, it's some agents kind of deter from this, but you're literally helping an individual that might not know they have a choice on what healthcare plan they're going to be on. And again, the healthcare plans that you sign them on the dual SNP plans that are available to an agent to sign them on, will be rich in other benefits, right? So the MMP won't be as rich in dental, in hearing, and vision, and transportation. They will give some transportation, but some of these carriers are just, giving away the farm pretty much. And just to keep in mind that, you're helping that individual make a choice. So what happens if the beneficiary loses their Medicaid coverage? Do they just get dropped off the plan and now you got to go rewrite them, or do they have to talk to their caseworker? What goes on here? So if a beneficiary loses their full Medicaid coverage, they'll be allowed to remain enrolled in that dual SNP plan until they regain their full benefits, which can take, maybe a month, 3 months, but it won't be any more than 6 months. After that, they will be dropped. During that grace period, though, you want to make sure that you explain to them that they're going to incur out-of-pocket costs for their Part B premium. So remember in that previous slide, it was paying for their Part B premium. Well, no more if they're in that grace period. Now, if they go back on to their Medicaid coverage, it will go ahead and retroactively cover those costs, I believe. So if you have questions on that, definitely give me a call back. Obviously, the 20% coinsurance of Medicare covered services will be due at that time as well. Supplemental benefits are covered at the same level. And then the member does receive, oddly enough, because you'll hear a lot, I didn't know that they were auto-enrolling me. I didn't know. Well, actually, they get 3 letters. So sometimes they will open the last letter. It's important to tell your members, if you see anything from the state, if you get a phone call, if you get a letter, contact me, let me know. So that way, if you've already made that phone call to, Medicaid or Medicare, opting them out, and they're receiving that letter, then, that maybe something got not recorded right or whatever, but at least the member is letting you know, hey, I got this letter, and you can address it at that point. It doesn't happen over and over and over and over again, like we've heard. Usually it's kind of like individuals that have Medicaid and their Part B isn't being covered. So there are a little bit of gaps, and this is where agents are the bridge, right? We're the bridge to cover those gaps for these members. And when you do this, you literally will have somebody that is loyal to you, that's not going to be disappearing, because you helped them with their quality of life. So what happens if they don't qualify for Medicaid? Maybe they're like $4 over the limit, which it happens. Really briefly, what happens in that level is they now can qualify possibly for LIS, which is Limited Income Subsidy. Something to keep in mind, LIS is not Medicaid. Okay, so Medicaid is a state administered plan where LIS, extra help, is actually a federal subsidy program. So that is where I kind of keep it straight in my mind. The money comes from the same pocket, but two different administrators take care of it. So hopefully that helps you kind of break up how that works. I do have an LIS video on our YouTube library, so you can look up for that. And it kind of goes over a little bit how those limits are a little higher than your Medicaid. They all do have, help with their premiums, deductibles, and copays. That applies to most of the MAPD and PDP plans as well. And they also fall into an SEP, a special enrollment period, just like the Medicaid individuals do. So we kind of just, went over that again. Low income subsidy is also known as extra help. Something to keep in mind when you're on a low income subsidy and maybe you're not writing a DSNP, but you're writing a Medicare supplemental plan, when they're in LIS, also helps in that arena. So if you have questions about how that works, when you're dealing with an LIS individual, there are different programs that are available to them there. Now, do LIS individuals get auto-enrolled into Medicare? In other words, do they get their Part B premium covered? Sometimes yes, sometimes no, just like the Medicaid. You can enroll for the LIS extra help benefit through Medicare.gov with your member. It's very easy. I have a step-by-step guide that shows you where to go, what to fill out, how to help them. And it's really just an online application for extra help. There is a little box that you can check. And at that same time, they can go ahead and see if they're eligible for Medicaid. So that's something you can do, or they can do from their home. You can share screens and show them how to do that if that's something. But usually, if you are on the computer, you can go ahead and you're sitting across from them if they allow you to be in their home because of COVID and health reasons, then that's definitely something you can help them with as well. So this last slide, I think I just wanted to kind of briefly go over, how the commissions look. So the numbers, keep in mind, these numbers they're going to vary. They're not actual real numbers. I just use these numbers for easy math. So obviously on the left-hand side, where you see renewal rate 270, that is our renewal rate for this year, right? For anyone that you write that has been on a Medicare Advantage plan and they're now switching to another Medicare Advantage. That is usually the payment that you will get in January. These payments are prorated per month. So if you write someone February 1st, now instead of 270, you'll get 247. If you write someone in November 1st effective, you'll get $45 for that plan. So something to keep in mind, you will get prorated for some of the, when you write them, and some of the carriers will pay you full, but for the most part, it's prorated. Now, what I did was I went ahead and I'm showing you, if you were to write 10 policies a month, that's the total on the right. So, obviously, if you wrote 10 times $270, you have $2,700. And then so forth, right? 10 policies at $247, now you have $2,475. That's your income that you're getting per month. So if you were to write, just consistently 10 apps a month, and it's an MAPD commission, whether it's a dual or a regular MAPD, it's still the same amount. You would go ahead and add that up. And so if you did 10 a month, that is the bottom number is, the 17,550. That is what you would get for that first year. And so when you break it down, say that is your first year income. A lot of brokers miss the mark in the sense of not seeing how renewals work in this. So for instance, the following year renewals, you have 100 policies. Now, you're right. If I did 10 policies a month, hey, Yvonne, wouldn't that be $120 or 120 members? for the year? Yes, it would. But again, I went through, for math purposes, we're just keeping it rounded off. Plus, I take into account on average, if you do sign up 120, maybe 110, people pass away, they might move, a family member might take them out of the state and say, I'll take care of you. There's a lot of things that might happen. They might just, I'm terminating this plan. I don't want it, whatever goes on. So I just did it for 100. So if you had 100 people at the 270 renewal rate, your first year renewal income would be about 27, right? Now that's not counting, because you're going to still be selling that year. You're not just going to kick your feet up and go, okay, well, I'm just going to wait. I guess you could, but why would you? You're doing a service to people, you're explaining stuff, and you're growing your book of business, because that's what we do. We're professionals in this industry. So then when you add up your renewal plus your present sales, you have the total potential of making somewhere around 45,000 for that second year. So something to keep in mind. And, for the most part, I think we kind of missed that mark a little bit. If you do have any questions, like I said, this is going to be short and sweet. Definitely here's my contact information. You can let me know, and I'll get back to you. My email, I usually get back in text or email within 24 hours to brokers. So I'm always readily available. If there's any, questions at this point, please go ahead and type them in. There was, some information we'll be passing out, those handouts for you. And hopefully I touched some things that might maybe ask you, you asking yourself some questions that I can clear up for you. And hopefully you had some information that you didn't know before. And we'll talk to you soon. Again, this is Yvonne from IAD, and I appreciate your time.